So hello students, I'm back with another video. It's important video named diabetes in pregnancy. As you can see, I've mentioned. So let's start. So before starting diabetes, we need to know about insulin as well. So insulin क्या है? Insulin कहाँ से secrete होता है? हम सभी को पता है. It's secreted from where? Beta cells of Langerhans, which is situated in where? At pancreas, right? Now insulin का role क्या होता है? What's the role? So insulin, the role of insulin is what? Let's before that let's draw something. Let's assume these are blood vessels. Let's assume these are blood vessels. Okay, now and these are cells. So the role of insulin is to move glucose from the blood vessels to our cells, so that in our blood vessels, or you can say in our blood, the glucose level remains normal and the cell can get the glucose for their as a fuel or as their food, you can say. So blood vessel में glucose की मात्रा normal रहे. That's the role of insulin. So when we see that insulin is increased, so what happens if insulin is increased, that means blood glucose will be less. So if blood glucose will be less, that situation leads to what? Hypoglycemia. On the other way around, if we say that if insulin is decreased and the blood glucose is increased, मतलब ये तो वाइस वर्सा हुआ ना, अगर इंसुलिन डिक्रीज्ड होगा तो ब्लड ग्लूकोज इंक्रीज होगा, सो दैट विल लीड टू व्हाट? हाइपरग्लाइसेमिया. So this is a basic concept, we all know that. So now in pregnancy, what does the role what is the role of the insulin? We will be reading it now. So first, जैसा बेसिक रोल हम सब ने जाना, सो इंसुलिन इज़ अ इम्पॉर्टेंट हार्मोन इन प्रेगनेंसी एज वेल. सो इंसुलिन वैसे तो मैंने बोला है कि बीटा सेल्स ऑफ लैंगरहैंस विच इज सिचुएटेड इन पैनक्रियास, यहाँ से ये सिक्रीट होता है. एंड व्हेन द फीमेल गेट्स प्रेग्नेंट, सो इट स्टार्ट्स secreting at 11 to 12 weeks of pregnancy. Insulin is not only responsible for maintaining the blood glucose, and including that it's also helps in what? Lipolysis. Okay, then in case of pregnancy we can say it helps in growth of the fetus as well. Okay, so remember these 2 points. So in pregnancy it starts secreting from 11 to 12 weeks of pregnancy, and it helps in the growth of the fetus as well. So when does the insulin resistance happens? Oh, before that you need to know pregnancy is a diabetogenic state. Okay, so it's a physiological phenomena, you can say, and insulin resistance is a must, or you can say physiological feature of pregnancy. Okay, and when does the insulin resistance happen actually, or when does the insulin resistance start happening? So it starts from, the insulin resistance starts from 24 to 28 weeks. So insulin resistance means what? अगर insulin resistance हो जाता है, if you can say, I have just written here that pregnancy is a diabetogenic state, and I'm discussing it again. If in case if you can't see, pregnancy is a diabetogenic state, so it's a normal phenomena, you can say. normal phenomena. And insulin resistance on the other hand, you can say it's also normal phenomena in pregnancy. And when does it starts happening? So from 24 to 28 weeks it start happening. So when insulin resistance happens, what does it cause? If there is insulin resistance, means then blood glucose will be increased, right? ब्लड ग्लूकोज विल बी इंक्रीज. सो अगर इंसुलिन रेजिस्टेंस होता है तो वहाँ पे ब्लड ग्लूकोज इंक्रीज होगा. एंड व्हेन विल इट स्टार्ट? फ्रॉम 24 to 28 weeks. एंड द हार्मोन दैट इज responsible for the insulin resistance is what? HPL, human placental lactogen. And from where it is secreted? HPL, the hormone secretes from HPL secretes from where? Syncytiotropoblast. Syncytiotropoblast is a part of a blastocyst. So just remember this now. So there's a question, so you can be asked that when does the insulin resistance happen, when does the insulin resistance start, and which hormone is responsible for that. Here's another question arises. And from where the HPL secretes? Syncytiotropoblast. There's a question also, when the insulin starts secreting in pregnancy. When does the insulin start secreting in pregnancy? That is 11 to 12 weeks. And insulin is also responsible for the growth of the fetus as well. Okay. So now, mother to fetus, glucose to be transported, because fetus is solely dependent on his or her mother for the food, actually, you can say. So glucose is a kind of food that he or she is getting, right, the fetus. So fetus is solely dependent on the mother for the glucose. So there is a way so that glucose can be transported from the mother to fetus. So there is a transport called GLUT1. Here another question arises. GLUT1. So mother to fetus, glucose will be transported via the transporter named GLUT1. Now, if there is maternal glycemia, okay, before that another fact arises. Glucose can be transported, or glucose can be transported from mother to fetus via this transporter. Now when in this case maternal hyperglycemia arises, so there will be insulin resistance, right? So if there is insulin resistance, that will lead to what? Maternal hyperglycemia. So due to the maternal hyperglycemia, what will happen? The glucose will be transported to the fetus as well. So fetus will also cause what? In fetus there will be also seen what? There will be seen fetal hyperglycemia. So due to the fetal hyperglycemia, fetus will do what? Fetus will start increasing. Fetus will do what? Fetus will start increasing or start producing more insulin. So what I have said in the earlier, just that insulin is also responsible for the growth of the fetus as well. तो आप कह सकते हो कि insulin will do what? Insulin will do macrosomia in baby, because if the growth of the baby, insulin will do what? Growth of the baby will increased. So growth of the baby if increased, then the baby's weight will be increased, and it will land up into what? Macrosomia. Macrosomia, in the previous video I have discussed that the baby's weight will be beyond 4 kilo. And to be specific, if I say more than 5 kilo in case of in case of a non-diabetic mother, and in case of a diabetic mother 4.5 kilo. So it ranges between 4 to 5, you can say. But if you will be asked, there will be single answer. If you have to choose a single answer. So more than 4 kilo, 4 to 4.5 kilo if the range has been asked. So more than 4 kilo, if the baby's weight is more than 4 kilos, then the condition will be called or termed as macrosomia. Okay, so here's another fact arises, that is glucose can be transported from mother to fetus, but insulin can't be transported, is it visible? Transported from mother टू फीटस, मतलब ग्लूकोज मदर से फीटस में जा सकता है, बट इंसुलिन कभी मदर से फीटस में नहीं जा सकता है. दैट्स वाई द लाइक फीटस हाइपरग्लाइसेमिया हो रहा है. तो द फीटस इज प्रोड्यूसिंग द इंसुलिन इज इट्स ओन, नॉट द मैटरनल इंसुलिन इज गोइंग, राइट. तो अगर इंसुलिन मैटरनल मदर से फीटस में नहीं जा सकता है, तो देयर इज अ बेनिफिट, वी can utilize it. So drug of choice of diabetes in pregnancy, if you will be asked, that will be always either the diabetes in pregnancy drug of choice or drug of choice for the gestational diabetes in pregnancy. The both answer will be the same, that is insulin. क्यों? क्योंकि इंसुलिन doesn't go from mother to fetus. Okay, so insulin अगर mother in diabetes, in a pregnant mother with diabetes or in a gestational diabetic mother, if we can give insulin, that will not be transported from mother to fetus. So always the drug of choice should be insulin. Now glycosuria, there is a term I have written. Glycosuria is what? There is a glucose in urine, right? And it's pretty normal in what? No, normal in diabetes in pregnancy or normal in pregnancy actually, but it doesn't denote, glycosuria matlab it doesn't denote that the mother has to be diabetic, right? Because it's a normal phenomena in diabetes. And including, I'm repeating again, that insulin resistance is also a normal phenomena in diabetes, including pregnancy is a diabetogenic state. These are all normal phenomena. Okay, so glycosuria doesn't denote, agar patient ko via the urine you see that mother is having glycosuria, that is mother is having glucose in urine, so it doesn't denote that mother is diabetic. Okay, so you have to like treat her on the giving insulin and what. Before that you have to go multiple steps or multiple tests you have to carry out before confirming that. So glycosuria doesn't denote that the mother is diabetic, because it's a normal phenomena in normal phenomena in pregnancy. Now let's move on to second point. Okay, so you can see that I have written over diabetes and gestational diabetes mellitus. So over diabetes is what? Over diabetes, that before the pregnancy the female is diabetic. It's not that after the pregnancy female has got diabetic. So before pregnancy, the pregnancy से पहले ही the female was diabetic. So diabetes mellitus present, but gestational, in the name it suggests gestational diabetes mellitus. So in gestational diabetes before pregnancy it's not present. Now let's, day 1 of pregnancy diabetes is present, right? Day 1 pregnancy diabetes is present, but day 1 of pregnancy in case of gestational diabetes, no diabetes is present. First trimester, so what does first trimester suggest? Which span or which duration we will suggest as first trimester? So it will be first week of LMP to first week to 13 weeks 6 days. Now what is second trimester? 14 weeks. First day of LMP to 13 weeks 6 days, then 14 weeks to 27 weeks 6 days, that is second trimester. And third trimester is what? 28 weeks to 40 weeks of pregnancy. Now what is first trimester pregnancy? In first trimester pregnancy, the over diabetes cases, that the over diabetic female is also diabetes mellitus will be present, but in gestational diabetes mellitus in first trimester it will not be present, the patient will not be diabetic. But now comes the second trimester, and in the earlier page I have already said that insulin resistance starts from when? Insulin resistance starts from when? 24 to 28 weeks. So can we appreciate that the patient diabetes mellitus, over diabetes mellitus female will be diabetic, and the gestational diabetes mellitus female will also be diabetic, because 24 to 28 weeks insulin resistance started. Now in third trimester, diabetic mellitus positive diabetic, not a diabetic, you can say it by blood sugar, or diabetic mellitus you can also say blood sugar will be raised, increased blood sugar. No blood sugar, no diabetes mellitus. But now in case of second diabetes mellitus the blood sugar will start rising, because 24 to 28 weeks there is a insulin resistance. In third trimester, blood sugar will be also increased. In case of gestational diabetes, blood sugar will be also increased. But after delivery, what happens? After delivery it will still raise, blood sugar will be still raised. But in case of gestational diabetes mellitus, the blood sugar will be decreased or start to come at a normal range, you can say. So after 6 weeks of delivery, we have to carry out a blood sugar test or a GTT, we will discussing next, or a GTT test, that the patient, the gestational diabetic mellitus patient is coming back to the normal range or not, right? So after 6 weeks of delivery, we have to carry out what? The GTT test, for confirming that the patient the patient has come to a normal range in terms of what? In terms of blood sugar, etc. So now GTT. What is GTT? GTT means glucose tolerance test. So glucose tolerance test will be carried out in case of, in our Indian population, if the mother gets pregnant. So irrespective of the, you can say irrespective of their gestational age, or what do you say, irrespective of the gestational age, when the mother comes for a first antenatal visit, then the mother will be asked to have 75 grams, or will be given 75 grams of glucose, irrespective of their previous meal, and no fasting will be needed to carry out the blood test. In case of blood sugar test, what do we call it, the FBS, right? First fasting blood sugar. So we tell the patient that overnight fasting is needed. But in case of antenatal mother, no, we should not tell her that overnight fasting should be needed. So no overnight fasting irrespective of their first meal, and no overnight fasting to be encouraged, because unless if the mother is unfed, no, if the mother can't